Whoa, 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 whoa. Before you hit the next button, before you swipe left, right, up, or down, give me an opportunity. All right. The episode will start after this. I thank you so much for tuning in to the Let's Get Comfy podcast. I am Norman Harris, the host of the Let's Get Comfy podcast and also the owner of Comfort Measures Consulting, your favorite black bearded bald guy. Right. So I wanted to share with you two reasons why I started the podcast. One was to provide insight and knowledge to individuals that are in need. Right. Caregiving is such a journey, whether you are caring for an elderly loved one. Sometimes those journeys can be years. And I've talked to several family members that have been in that situation. And I want to provide a platform that allows them the resources and information easily accessible by tuning in, but also a platform where it can enlighten people on different topics and concerns that they may have never researched, right? Hearing from expert leaders. And that leads to the second reason. There's a lot of people that do wonderful things in healthcare, not only hands-on, but there's other entities such as biomedical waste, medical devices, pharmaceuticals that play a vital role in providing that direct care that we see in hospitals, skilled nursing facilities, clinics, and physician offices. So I hope that by tuning in to the Let's Get Comfy podcast, we put you in a better situation for you and your family to prepare you for those health crises that may have come. Right? We all age. That's one thing we can probably all agree on, that if we keep living, we will get older, we will age, and let's be prepared, and let's do that together. Please subscribe to the channel. Please comment as well. I would love to have your advice on how I can improve and grow with me. Right, I'm just starting this, so let's start together. Let's grow together. Let's get comfy. Our first guest is a man that I had to have him as the first person on the episode. He's an FDMA award winner 4 times in a row. The Maxis 2000 award winner. He held several positions in Florida healthcare. He's actually been a part of the Florida Healthcare Leaders program as well. He's been in the military, holding several military awards. He's also won regional administrator with IHS. But most of all, that's near and dear to my heart, he gave me my first opportunity that changed the life of my family and what I'm able to provide for my family when a lot of people didn't open the door for me. Didn't respond to emails, didn't respond to calls. He did, and it changed my life, changed my family life. So first guest, Reginald Eldridge, man, forever in my heart. Tune in, like, comment, subscribe. Yes, sir. My man. My man.
Man, no, that's a whole nother level right there.
Man, hey.
I was looking around to see who you talking about.
I'm talking about you, man.
But that's
I'm
amazing.
talking about you,
introduction.
man.
I truly appreciate it.
Yes, sir. Yes, sir.
You know, it's an honor.
Man, I'm glad you're doing this as the first guest. It means a lot to me.
It means a lot to me too, man, that you have me as the first guest.
You really launched, my start in healthcare overall in the healthcare leadership arena as a nursing home administrator. So I want to start off with introductions of how we met.
Sure.
And I'll take this piece and I'll let you delve in on that. So
okay.
I'm searching, wanting to become a leader, looking for a direction in my life. I felt like at the time, man, I'm in debt, going to school, got a master's degree, and I'm here working at MetLife in account management. No knock to MetLife, but I wanted more for myself, right? I always saw myself as being a leader, entrepreneur as well. So my cousin introduced me this, Gregory James. Shout out to him, big cuz.
Oh yeah, great.
He introduced me to a nursing home administration role. So I looked on the website, found out how to become a nursing home administrator. I started the process. They had this long spreadsheet, right, on the website, the preceptors list. So I would go on lunch breaks at MetLife, my 15-minute breaks, and I would call and email different preceptors on that list that I was willing to drive, right? It was in my area. I made a spreadsheet because I never got a response. No one would call me back. I met you, man. gave you a call. I looked you up on LinkedIn, and I messaged you. I still have the screenshot of our conversation when we first met. The screenshot, I saved it in my phone. And because you responded to me. And that meant a lot to me. And from there, you said, man, come up here and see me. We sat down across from me. I told you my dreams, my vision. You listened to me. You said, man, I'll give you an opportunity. So that was after 7 months of searching.
Wow.
7 months for searching a preceptor. That's how I met you. Yes, sir.
Yeah, so that was what, about 5 years ago?
Yep, about 5 years ago.
5 years ago. So how I remember it, like I said, you did. I got the message from you. And I looked on, I'm okay, so man, seemed interested, man. He's pursuing it. Hey, let's have a discussion. So I did, sent you back. And then when you came in, the first thing I saw, man, this dude came in all professional. He came in. he basically had a situation where I was like, this young man was raised right. Because he basically is very respectful, just very, and I could tell in our first conversation, that, this is, you don't do anything without research, thinking through. Yeah. As I became to know you, I know far more about it now. Yeah. But I knew that for you to come there and to talk about it, I knew that's if you were really going to try to do that, this was something that you were going to be successful at.
Yes, sir. Thank you.
And I did want to be a part of that because I saw that. Okay. Yeah, I remember when I first tried to get an administrator's job and a preceptor. Actually, it took me a long time as well to find somebody to do that for me. So I had said, and I think we talked about it before, if ever I'm in the position to do something to benefit somebody, and that's the right person, because you got to be selective about that too. Can't give that opportunity to everybody. Right. And it was going to have to be a year. It needs to be somebody that you figure you can, you can have a good relationship with, good work relationship with. Right. And I felt that from you, day one.
Thank you.
I think I told you that.
You did.
I think I told you day one.
Day one. Yeah. And then you also said, I have to be willing to stay in the office with someone because,
right.
I used to sit right in front of your desk. So I got to be willing to stay in the office with somebody that, have a good relationship with.
Absolutely.
So,
Absolutely.
Thank you, man. I appreciate you. You changed my life. You changed the life of my family, man. So people have to realize when you give someone an opportunity, it affects them monetarily. And what the world revolves around, what your livelihood revolves around, right? It's finances. Just being honest with you. So I appreciate the opportunity that you gave me. Seriously, man.
I'm glad.
That's why I had to have you here as my first guest. It was in between you and my cousin. Yeah, because he's the one absolutely sort of started me with it all. Yeah. So
Greg's a good one too.
Yes, sir, for sure. So I want to move into just your current role and what you're currently doing now.
All right, currently, which is funny, kind of how life cycles. I actually am back at the facility that we precepted you at. I was at that facility for 8 years. I was there from 2013 to 2021. Left, went to another company for a project. Actually, a facility was going to be totally renovated. They were going to put some money in a building, and they wanted, some leaders and a team building and that kind of thing. So I went to another company for 2.5 years. At that point, I was leaving there, and I said that my next step is going to be to do maybe interim administrator positions and to do some training and some things along that line, more consulting. Yeah. And I got a call. I left on, like I said, the Friday, I want to say July 14th, a year or so ago. The next week, I got a call for my first interim assignment initially, and they wanted me to go back to, at that time it was called Heron Point, as an interim administrator, and they had an AIT. And I thought about it because at that point, I was doing a lot of traveling, and my wife had spent a lot of time in Atlanta, and I was trying to reactivate my Georgia license as well. So I was trying to decide what I wanted to do. And I did. I went back, and currently I'm at that same facility. In December, new ownership came in. A company called Aspire, guys based out of New York, and they bought 56 buildings in 3 months. From September to December, they acquired 56 facilities. Mine was one of the later ones acquired in December. So that's where I am now. The AIT I had is finishing up like in another week.
Okay.
But I've actually been at that facility since from July,
July.
August last year until currently now. That's where I'm at.
Yes,
same seat I was at with you.
Man, listen. Man, they smart. They know what they're doing.
Yeah,
they know what they're
cycle.
doing.
You know, I left. I wasn't planning to come back, but you know, hey, what do y'all like work?
So I know you have your own. You're an entrepreneur as well. You have your own company. So if you just expound on your company, its origins, and
my company and my wife and I started companies like you and your wife back in 2000. We started a company called QRQ Enterprises, which basically was my 3 kids' initials. My oldest daughter, her name is Clevia. My middle son, and oldest son, actually, middle child, is Reginald Jr. My youngest son's name is Quentin. And so we said QRQ Enterprises. And we initially started it because we were doing network marketing as well.
Okay.
And as well as my wife is an HR consultant. And of course, I'm healthcare. So we said, well, let's do this. And initially, I was doing interim assignments. And then she was doing like grant writing and things of that nature. So we're doing both things out of QRQ Enterprises. Okay. And so I did the interim assignment thing for about 4 years straight before I actually took a permanent position.
Right, you told me.
Once I started, yes. So from 2000 to 2004, I just did interim assignments under my company thing.
All right. So as you transition into and you told me, I know personally, you said you're trying to, with interim roles is a target area for you. But outside of that, what are some of your hobbies or interests?
All right. Well, I do a lot of hobbies. Well, I like sports, man. We always talking about that. I love sports.
Oh, yeah.
I'm getting too old to play anything. So I definitely watch a lot of stuff.
Okay.
I'm not a golfer per se. I did, I talked about this before. I actually, for the first time since I was a teenager with my dad, went fishing. A couple of friends of mine, we actually went on a charter boat out of Clearwater.
Oh, okay.
And went fishing. So I said, well, I'll do some of that too because it's some things. But as far as hobbies, don't have a lot, man. I do, I try to do, for whatever reason, try to do some gardening, things like that.
Oh yeah. I just started a garden.
You do some that? Okay.
That was actually my New Year's resolution.
Yeah, I try to do something that. I was
collard
actually
greens
talking to my
out there,
sister.
man.
There you go.
Nice
I was talking to my
greens.
sister. But collard greens big with her, huge.
Go yeah.
And she was talking about it's in our Eldridge gene because my dad actually, when we were young, always had a garden. Always had a garden.
My dad too.
Yes. And we lived at that time in the inner city. My dad would grow everything
in the inner city.
In the inner city, my brother.
Yeah, he was serious.
Inner city, yes, he was serious about it. My dad was from Alabama originally, but he always wanted to garden. My grandmother, his mother, actually, take it back a step. My parents, my dad and his family migrated from Alabama when he was 10. And they moved initially to Buffalo, New York. And they basically were in the inner city. And my grandmother lived in a high rise, kind of like a project thing. And in her apartment, she had plants like crazy. You go into her apartment and plants were everywhere. And this is, like I said, in a high rise project, because again, that planting, the growing, taking care of plants was in the blood. My dad, in our house, we actually had a house. In our yard, we had a little fence beside it, planted a garden every year. And one of the things he planted was corn. So you think about it, you're in a city with a fence, and you don't have a cornfield. He's growing 5-6 stalks of corn up beside a fence. He's got other green vegetables growing. He's got beans, he's got peas, he's got all kind of things growing. Flower garden on the other side. So I think I've always had an interest in that. And at that same time, as a young kid in the city, they had I want to say 4-H program that they give us a little plot where we could grow vegetables. As a bunch of kids in the inner city grow their vegetables, and then once they're grown, we could take them home. And I grew mine, took them home, and some people saw them, my neighbors saw them. I started selling vegetables. I sold my vegetables quickly.
There you go.
They were like, those are great. I ran out, actually went home, went in the refrigerator. They were asking for Started taking green peppers out the refrigerator that my mom had bought from the store, taking them to the neighborhood and try to sell. My mom squashed that part of it. But my entrepreneurial start as a because I went a little past what I should have gone.
There you go. Well, some kids out there, start selling vegetables, man. Start selling vegetables.
Hey, I grew up myself, and it was something. So again, that's always been in me to plant something and do some of that stuff. So it's kind of relaxing.
Good, man. Thank you for that story. No problem, that's a good one. Okay. So what do you think has stayed the same about you throughout your life?
Okay. One of the things probably, I think my basically my personality, I guess the way I interact with people, I think it's always been the same. I kind of always have been sort of a people kind of person. Kind of got me in trouble in school sometimes, talking in class, things like that. But I think that stayed the same. I've always had that kind of a, energy, I guess.
Energy, yes.
Or yeah.
Yeah. So, what's new in life right now? Like,
what's different? What's changed?
What's different? Your personal home life? Yeah, yes, sir.
Oh, you mean with the little grandson or something?
Grandson.
Oh, okay.
Yes,
okay. Yes.
Sir.
All right. So a year ago, June 14th, a year ago, my oldest daughter, who lives in Atlanta, had a little child, my grandson, the only one I've got. His name is Julius Ellington Williams.
Oh yeah.
And
that sounds like he's gonna be somebody in life.
Man, I hope so.
He's gonna be somebody in life.
Little active guy. Like I said, we had his first birthday party last weekend in Atlanta.
All right.
Interesting enough, that you brought that up, my birthday is June 15th. So this weekend, 1 week ago today, he and I had a joint Peter Rabbit birthday party.
Yeah, Peter Rabbit birthday party. Oh,
so that's kind of new.
That's good, man.
It's
so it's 14th and you the 15th?
Yeah, I'm the 15th to 14th.
That's
just couldn't wait that one more day, but that's how it is. But I probably have no more birthdays now, no more birthday celebrations.
I was about to say, yeah, man.
I'm done with that. And this year it was 14th, 15th, and Father's Day was 16th.
16th, okay.
So, it kind of everything was last weekend.
All big old, you had an explosion of celebration.
There you go.
What you enjoy most about being a grandparent?
I kind of just, I guess, seeing him grow, see the development, and the changes. He's changed so much in 1 year. And what's something I forgot about, because again, you got young children. My youngest child is 30, whatever, something, Quentin. Way up in 30s. I forgot how much energy little kids have. And just observing that, observing the he looks at everything, he wants to touch everything. Just the energy he brings, this is something. And my wife is, far more than me as far as, because she's, she spends most of the time with him, period, since he was born. She's either in Atlanta with him, or, and as a matter of fact, today he's here in Florida with us. Okay. But just observing the time we spend with him. That's good. Every morning he wakes up kind of happy, and he's happy to see me when I come in. So it's basically joyful.
Yo, very much so. Very much so, man. Thank you for sharing that. That's an intimate type of topic, man. So that's definitely with kids, with two kids. My kids, everybody used to say they looked like me when they were bald. When they didn't have any hair, my girls. But once they start getting hair, that's when they start looking like
the mom. Okay.
Yeah, man. I was like, golly, y'all wrong for that.
And Norm, you're a handsome gentleman, but thank goodness the girls look like the mom.
I pray for that.
There you go.
I pray for that. I'm glad
your prayers were answered.
Yes. Okay. Yeah. All right. So looking back, what was one of the most important lessons you learned from your childhood?
Wow. Okay. Yeah, let's see. What lessons I learned from my childhood? That's interesting. I think one of them was how to navigate, how to get along with others. I was the oldest child, so it was 3 years between me and my sister. So there was a period of time I was the only child, and I know that when my sister came along, excuse me, I think there was a little, I don't know, I can't remember it all, but people tell me about it. And then when I went to kindergarten, I kind of didn't really get along well with some of my classmates. I had to learn kind of how to play well with others.
Did you a fighter or something?
I did it. I used to get in trouble. how you in kindergarten getting called to the principal's office?
Yeah.
I don't remember how, but I know that I was, yes, my mom tells me and my dad tells me.
Did you have like a jealous spirit or something over your little sister?
I don't know what it was. One thing I remember, and I tell my kids about it, I think I remember one time it had to do with a peanut butter and jelly sandwich.
See?
And I think, and I don't know whose peanut butter and jelly sandwich it was. I don't know if it was mine or for another kid, but I knew there was some conflict.
Yeah, see what I'm saying?
Over peanut butter and jelly sandwich.
You want to take everybody's stuff.
I don't remember. I don't remember exactly if it was me or if it was him doing it. I don't remember. But I learned as a child to you got to play well with others.
Yes, sir.
And then and to appreciate my sister and that kind of thing. 'Cause it was, like I said, it was 3 years difference, and I didn't like her touching my stuff and all that kind of thing. So it was, I learned that as a child.
That's good.
Which is a lesson that we need to today. I'm always dealing with trying to get people to learn, and you got to get along. You don't have to like each other.
That's one thing I'd say you was masterful at. Just seeing you just in our morning meetings and how you collaborated with the team, in the stand down meetings. You know how to manage different personalities.
Yeah,
and that's a strong suit, and that's something you really necessarily. I don't know if you can necessarily learn it, in college or high school. You know what I mean?
Yeah,
so,
there's a lot of things that happened in my life that helped me do that too. But you haven't talked about some of them. But yeah, that's. It is definitely something that's needed.
Yes, for sure.
In the industry.
Yes, sir.
Anytime you're managing people or leading people, that's something that's important.
Okay. So who would you say was one of the most influential people in your life?
Obviously, first, my dad. My dad was someone who was in the home, so that was good. He was a hardworking gentleman who he traveled a lot. He actually, when I was born, my dad was actually working in a factory, I want to say, making furniture, steel, not like file cabinets and things like that.
Okay.
He worked for a company that was doing that. And I remember as a youngster, and I don't remember how old I was, he had an accident in there where either a file cabinet or something fell on his toe and his toenail had to be removed and that kind of thing. And he was like, he always wanted to do something different. And he the next thing he did was kind of get into selling insurance. And so then he could, wear a shirt, tie, kind of thing, which is what kind of got me doing it.
I got a question.
Good.
Was he able to get a lawsuit out of it?
I don't remember.
Oh, gotcha.
I honestly don't remember now about that.
Yeah,
it was back in that time, I don't remember if even people pursued lawsuits like that.
Everybody.
You know what I'm saying?
Everything.
I know. Oh, now it's today that would have been a whole different thing. You know what I'm saying? That would not have been. He wouldn't have been looking for another job right away. But I don't think that's how that went. No, I don't remember that. No, but he had to work. So he started concern insurance, and then the next job he had, which he had for the remainder of his work life, was being like a sales rep for General Foods, and he was in the Maxwell House division. So he'd go around the stores, stock their coffee and things like that, and go to meetings and that kind of thing. They gave him like a company card, and moved us and that kind of thing. But so he was my first role model or first person I really looked up to. Plus, he had years before, as a young guy, been in the military, and he had met my mom, and I was in the military.
Okay.
So I think that's one of the reasons later on when I did join the military was, my dad did it, and I guess I can do this too, kind of a thing. But so he was first important. Yeah, he was my first role model. Mm-hmm. Another one that kind of touched this industry, we'll talk about in a minute, was my mother's mother, my grandmother. It was Grandma Shields, and at age 5, I can remember she became a nurse at age 40. So in her 40s, she became a nurse. Something she always wanted to do because she was, like domestic and doing things like that. And then at 40, she became a nurse. And we went to visit her, and she was living in Petersburg, Virginia. And I guess she had what you call like a rest home. I didn't know what that was. And all I knew, there was old people in her house. I didn't know why. Years later, I learned more about it, but I was 5. So I saw that, and she was always somebody who, always stressed, spirituality, religion. Yeah. She wrote poetry. She did a lot of things. She played piano. Always, read her Bible, things like that. So she was somebody who, I definitely, looked up to as well. Outside of my family, let's see who. I guess I did kind of, look up to Maybe some of the men in our community and my parents, one of the things too, as I was coming up, they bleed in church. I know you and I talked about that as well, which definitely kept me on the straight and narrow a lot coming up. We be in church every week. So, I looked at, some of
Just weekly?
Well, at least weekly.
I was in church Tuesday, Thursdays, and Sundays.
Usually, now sometimes I had to say more than that because yes, we were in youth programs, things like that. So we'd have youth programs and things like that where we would go on like Sunday, and then maybe prayer service on Wednesday. Gotcha. But yeah, I was there Tuesday.
I wish I had that church. Three times a just, man.
At least 3 times every week.
Yeah.
Yeah, we were in the house of the Lord at least 3 times. House of the Lord. So worship was really very important as well. So again, I looked at some of the the people in my church, things like that as well.
Thank you, man. Yes, sir. So I want to sort of take us on the path of your journey to becoming a nursing home administrator. Okay. If you would just take us on that journey from your college point.
Okay, sure. All right. So after I actually went to college after I got out of the military. So I joined the military at 19, and actually I'd gone to a year college, and then trying to decide what I was going to do in the summer. I really didn't have any true goals yet. I didn't know what I wanted to do with my life. And my dad, again, who had been in the military, was saying, well, you probably need to join like the National Guard or Reserve in the summer to do something, Well, the thing was, since 14, you always had to do something in my house. My mom, my dad, there was no just not doing something. You were going to work, you were going to volunteer, you're going to do something. So, I always knew I had to do that. So we were talking about it, and he was like, well, yeah, you probably need to, maybe go down to the recruiter and talk about it. So I went to talk to the recruiter, and when I got there, it was interesting. One of the guys who had been with me that year in college, we had gone to school that 1 year, was there. And he was going into the Army. And the thing was, the recruiter started talking about, well, you guys go on a buddy system, go active duty on a buddy system. I'm like, I'm down here just to do the National Guard thing. And it's like, well, no, if you go on the buddy system, the Army, you go in, we'll pay for your education. You can go pick it where you want to go. Okay. All this adventure. He started talking good. It made me seem like, I may think about doing that. My friend, and again, we weren't very close friends. We just had gone to school together, was ready to go right away. So his thing was, they were going to take him. He was ready to go. And so
he probably going to go to the front line.
He was ready to go. He was in artillery. He was going to go. He was ready to go.
I knew it.
And they were like, well, you guys go in, you go to basic training together. And then here's the different jobs you want to do. I'm like, I'm not doing what he's doing. So they gave us some choices. And my dad had been a medic in the military. And I'm like, well, medic sounds better than what you doing. So, I said, I'll do that. And then they said, well, you can go in as a buddy system. You'll go to the same base. And then when you get ready to go to your school, you'll transfer to another spot, that kind of thing. But you guys will always be together. And I said, well, I'm not quite ready to go in yet. So he went in, I went delayed entry. So 30 days later, I went in. And so we did go to the same post, which was Fort Sill, Oklahoma, did that. Okay. Then the medical is at Fort Sam, Houston. I left and went to Fort Sam. Became a medic, did 3 years in the military as a kind of field medic, Army medic, and then came out looking for what I was going to do next, which was, I thought then I had a clear understanding. I need to go to school. The military is going to pay for it. I want to do something in business, but I want to also do something medically. So I went to college for healthcare administration, thinking, hospital. That's kind of where my focus was going to be. And as a senior, you had to have an internship. So I was already all the way up to a senior. Didn't have exactly what I was going to do. And companies were coming to the school, interviewing my classmates and promising jobs, internships and promising jobs in the nursing home industry.
Oh, wow. Okay.
And I was thinking, I never thought about nursing home, but, they're promising them jobs. Let me look at this nursing home internship thing. So kind of just by process of elimination, I said, let me try that. And I got an internship. I didn't have one right away, so it took me 2 months into the last semester to find one, to find somebody who would precept me even for the internship.
Right.
And
So that's
I
a nail
did.
biter for you.
Huh?
So you was going out to the wire with?
I was going on the wire. I was into February of my last semester, needing an internship.
Oh.
And there was actually 2 of us in my class, and we went to Philadelphia because our instructor said, you can get with this company in Philadelphia. It's called, I think it was called NHS or some NHC. It was National Healthcare or something that's offering internships. And I guess in Central City, Philadelphia. So he and I drove over, a white guy. We didn't know each other. We didn't run in the same circles, but because we neither one of us had an internship, his car was better than mine. I had a kind of just so up north in the winter, you kind of have what they call a winter rat, and my car was really struggling.
It was
struggling. And his car was a little better, so
what kind
we
of
took
car
his
was
car.
it? You remember?
At that time, I want to say, man, what kind of car was it? I think I had to. If I asked my wife, what was it? It was blue. It was one of those kind of cars. It was not.
It was
not
4-door, right?
Huh?
4-door.
It was a 2-door.
2-door.
It was a 2-door, and 1 door wasn't really working well.
God. Okay.
So yeah, it was a struggle. So I could say that. Yeah. So I get in my side. I was good. About get in on my side too.
They gotta get on your side too. Right, one at a time. Single file line.
So we did.
Yeah.
So we took his car. We went to Philadelphia. We did our interviews. We had our suits and everything, and neither one of us got it. We got back home, and they were like, thank you, but no thank you. And so the guy said, well, next, there's a couple places. And we were in upstate New York, and he said there's one place in Cooperstown, where the Baseball Hall of Fame. I took a bus, went there, did the interview, didn't get it. Came back, and then he said, well, there's a guy that's interested in AIT, and it's at a place called Eden Park, Catskill, New York. I didn't live near there, but he's willing to take you. So if you want to do it, go ahead. And so that's kind of how it started. I went to Eden Park, Catskill, got the internship. And because it wasn't near where I lived, I had to rent a room from a family there. Didn't have my car with me at that point. So I did a lot of, walking. I wasn't that far from the facility or, some things like that. And it was off there. I had to do actually 11 months. So I stayed there, and then up until May, my semester was ended. Okay. So my job bill ended at that point. So from there until November, I had to, basically cover my expenses without that GI Bill. A lot of that was due to my wife. My wife was working at that time. I was already married. Had gotten married as a junior, and she, she helped, kind of fund my effort to stay there, and worked out. So I did the 11 months, got a license in New York State, and then looked for a job for 9 months. Couldn't find a job. Could not find a job. And I would go to all these interviews, and nothing would turn up. So I actually went back to my hometown, and I was visiting with my aunt because I was trying to figure out what's the next step. And I actually walked into a company. I was looked up some things, and again, it's before the internet and all those kind of things. Internet, right? You kind of looking in the phone book. You're doing all those kind of things. Right.
Encyclopedia? Well, no, not encyclopedia.
Well, there wasn't encyclopedias though. Yeah, but that was not for things of that nature. So yellow pages and all that kind of thing. Yeah. I actually found a place that I walked into. Just walked in one day, and they said, I said, I'm looking for a nursing home administrator job. And they said to me, well, we might have a job for you. Nobody had told me that before. And I got a license in January. This is September. So it was actually July. And I was like, I was excited about that. He said, well, I'll tell you what, we're going to set up an interview for you, fly you down to Birmingham, Alabama. And so I'm upstate New York, and I was not planning to relocate. Right, I said, okay, fly me down to Birmingham, Alabama. So I was kind of, like, you got a place for me, but what? So, okay. So anyway, in July, they flew me to Birmingham. And when I got up in the morning, this is in July, the temperature was 46 degrees in Syracuse, New York. That morning I got up. I landed in Birmingham at noon. It was 93 degrees. So a 50-degree swing from the time I got on my plane to the time I landed. I got off the plane. I said, "There's no way I'm coming down here. No way." But I didn't have a job, mind you. So I met with the regional person and another person, and they said, the next day we're going to take you to kind of just let you look at some places. They took me to a facility in Birmingham, and I think it was called Fairview. And the next morning, I met a gentleman named Clarence Ball, who was the first black administrator I ever met outside. So I was licensed as a nurse administrator, had never met a black administrator before.
First one.
Had never met one. And I was one, had never met one, because nobody, until I met him. And he was down there in Birmingham, Alabama, and he was just leaving the facility that they wanted me to go to, and it was called Magnolia Haven, Tuskegee, Alabama. And he was leaving. He had been there for 10 years, and he had actually bought his own nursing home down in Mobile. I want to say it's called Twin Oaks or something. So that was impressive. I met this gentleman who not only was I found who had been at that building for a while, but now he was buying his own facility.
Right.
So I was very impressed by that.
I would be too.
So I ended up at the facility there. I did take it. I relocated my family, and just to kind of show you how long ago that was, it was 1985. And when I went down there, I moved my family down there. My first, I guess the salary they offered me, paid me, relocation, I'm making $20,000.
$20,000.
Move my family down and take an administrative job. So that's what we did at that point. And 5 years there, and then left there, went to Georgia. I was administrator in Georgia for 5 years, for 3 different buildings, and then came to Florida in '96, and I've had multiple facilities here in Florida in '96. But it's been a whole It's been a situation. A lot has changed over time. I know that's one of the things that we discussed.
Right.
Industry's changed. The industry's actually changed the last 3 years too after COVID.
Sure.
But it's a lot of things. But that kind of was my journey into nursing home, and then kind of what brought us up.
What are some differences you would say? Just name a couple of them. That when you first became or actually operated in the role, then and then compare it to now.
Okay, obviously technology.
Okay.
We have technology. Now everybody's got a computer on their wrist and that kind of thing. We didn't have a computer on our desk. When I started, no, not at all. There's none of that. Regulations were totally different. The way that they operated in facilities, like, how they talk about restraints and things of that nature. It was a whole different world at that point.
Right. Yeah. Go a little deeper in that.
Well, all right. So at that point, back in those days, if residents were hard to manage, they were not necessarily chemical restraints. They were physical restraints. So they would put, almost like a straitjacket on people, kind of a thing, to their chair and things of that nature, if they were not able to manage them, to kind of, and it was not looked at as being something that was abnormal, even though, you think about it now and all of the risks, that you do by putting restraints on people and things of that nature. But I mean, it was, regulations were different back in that time. That's one of the things. Yeah, it was.
So you possibly probably ordered some of those, huh?
Restraints?
Yeah.
They would be in the facility.
Yeah.
Pretty much put restraints on backwards and things of that kind of thing. When you have unruly patients and that kind of thing. And,
oh man,
it's crazy. It's a whole different world.
It's a whole different world.
Man,
so, that just
and then plus
right now.
The other thing too was we did not have what you consider like high acuity patients like we do now.
Oh, okay.
You still were in the early stages where you had a lot of, of the, just patients that needed, grandmas and grandpas who, who just needed care.
Just needed additional care.
And they didn't need a lot of medical care. Pretty much more of a kind of a rest home situation than it became. And we were. Yes, I saw that whole transition.
So how do you stay current with the changes in healthcare?
Okay.
The regulations and the practice. You came from.
Oh yeah.
Yeah. You just alluded to.
You got to stay current because everything's changed. Obviously, organizations like Florida Healthcare, I talk about, they have seminars and they have programs. So, I try to attend those. You know, they have a conference once a year as well, where they have a lot of speakers and things of that nature. There's a lot of things that now, again, with technology, online webinars and all those kind of things that you can stay current with, you know, and because the regulations change so often,
Right.
you know, there's always things coming out, and you kind of have to always be abreast of that, because, you know, from month to month, and especially when we went through COVID, things changed every month. You know, the regulations, the requirements. So it became a situation where you always have to, well, what are we doing now? You know, are we allowing people in the building now? You know, are we keeping, 6 feet apart now? Are we doing, all those kind of things?
So how do you help your staff to be engaged with educating them and keeping them motivated to actually, stay up to practice and stay in compliance?
Okay. Obviously, we have to communicate. I mean, things that I think one of the biggest things in facilities that operate well is just constant communication. And I know you do that very well. One of the things that really impressed me about you, Norm, was the way you communicated. And I told you, even there, as you come within the AIT, that there's some things you do even better than me. But that's one of those things that you can't keep everything to yourself. If you learn something, you got to quickly get that out to people that need it. And so that's why you got to either have, you either got to send it out in an email. You got to have, I guess we have on shift, we send messages out to everybody's, phones and, tablets and so forth. And we always have to have an all staff meeting at least once a month.
Yes.
You can't miss those because, you've got to get everybody together, if at all possible, share information. And then I always try to even come in on the night shifts and share information too. As things change, you got to have people be aware of it.
Night shift always said they'd be left out.
They always do. They always feel left out.
I always feel left out.
And you got to think about it. It's night. They work, 11 to 7.
Man,
and you got all staff meeting at 2 o'clock. That's the middle of their night.
I used to tell them, I said, well, you the one signed up for 11 to 7.
Yeah, it's got to fit your life. It's got to fit your lifestyle. Because everybody can't do that. It's got to fit your lifestyle.
Yes.
And so, so I do it like maybe once a quarter, and I tell them that's all it's going to be, about once a quarter.
Right.
I come in on your shift and try to give you an update. Because I'm not a
you're not camping out.
No. About once a quarter, I'll do that for you. But but that communication is key, man. You got to do that, and then, and that's in every aspect. You got to communicate, with the financial status of the building,
right.
What the regulations are.
Too. Yeah, transparent and just understand. Right.
What your regulations are. And then what happened during your surveys and things like that, because people want to know. I see people try to keep that close to the vest. It does not help you to not have people understand that, because they're the ones who have to make it work.
Right. You're fostering an engagement culture.
Yes. And if you have a policy, you have something like that, or you're trying to change something, or you had an issue, let's say with a survey, and you're trying to do a plan of correction. Plan of correction involves your team.
Yes.
How are you going to do the plan of correction if you don't let them know what the problem was?
Right.
And what we're saying we're going to do to fix it.
Yep.
And what their part in it is.
The surveyors come right back in and interview them, and they say the same thing.
That's what nobody told us.
Right.
See, can I tell you something real briefly about that?
Yes, sir.
But I saw that. It was really tragic. We had a facility one time, I won't mention the facility because I'm doing this, that actually, I guess, had failed survey several times, and had gotten to the point where they weren't going to they were losing their CMS accreditations. The facility was going to close down.
Oh, wow.
They were losing their Medicaid and Medicare funding. So all their patients were going to have to leave this building and go to other facilities, and all the staff were going to have to find new jobs. And what they were doing was, because the company was hoping that CMS may come back in on an off shift or something, and that they could be ready, they had the administrators in our company rotate to this facility, after hours, to kind of try to just, if they come back, to kind of just be there and help. Okay. So I was there. I had one night that I did it, and I'm there, and I'm kind of talking to some of the staff about it, and it was like 2 weeks out from when their building was going to be closed. And one of the saddest things they told me, which I took back to my building and told them, was, we never knew that it was this serious. Nobody ever told us that we had failed resurvey. we didn't know until now we get notices that we can apply at other facilities and all that kind of thing. Wow. So that's never going to happen, in the facility I'm at. You're going to know what the situation is. You're going to know what we did right, what we did wrong, because communication is the only way you can do this thing.
Yes.
Mm-hmm.
Yes.
Yeah.
Man, that's a great story.
Yeah,
really.
Man, it happens.
And that's sad too for the staff.
Sad. That building,
and
that building was closed for more than a year. You probably know the building I'm talking about.
Right. Okay.
But yeah, it was closed for more than a year, and then they reopened. Changed the name, did some things. But the sad part was that some staff were saying that they never knew.
Right. So I know you stated that the gentleman that you met when you moved to Alabama down here,
Clarence Ball,
Mr. Ball, yes sir. He was an inspiration for you. So
yes, he was.
What did that sort of help you when you saw the opportunity to become a preceptor? Sort of take ownership?
That was one of the things. Another thing was my AIT experience. I told you I got an AIT. I didn't really tell you a lot about it. But like I said, I was in Catskill, New York. This gentleman had agreed to take me on. Mm-hmm. But from the time I got there, he was he had never had an AIT before. So he didn't know how to really be a preceptor. And he was very closed up with information. Very, he almost was as if, you're there, but I don't trust you with any information. I don't, you're here, you got to do your time here, but you kind of got to do it on your own, kind of a thing. What the things I have to tell you, I'll tell you. Things I don't, kind of have to get on your own. So what I did was I kind of, I was assigned to each department. And one of the things I did, I took a pad with me. And as I went to each department, one of the things that I would ask them, because I was just kind of observing, I'd be in diet chat like, well, what things do you see? I go to the manager and I'm like, what could be better? What's going on? What's better? What things because each one of them was teaching me something because he wasn't. Mm-hmm. And interestingly enough, another thing that went on that started while I was there was a union organizing campaign that started, which made it a little worse as far as my interaction with him, in that, they had a lot of closed door meetings and I wasn't on the inside of those meetings. So I was kind of out there, dealing with the staff. Even though I wasn't management, I wasn't staff either. Right. So I was asked questions, and when people would tell me things, if he was a little more open, I could have helped him. Mm-hmm. I could have told him why they were bringing a union in. Because I learned all these things, as I was dealing with the staff. Because I was talking to them. They were telling me. Yes. They were telling me what the issues were. They were telling me that. So one of the things that I said, if ever I become a preceptor, I'm going to be the opposite of what this gentleman is. You know what I mean? You can learn what to do and what not to do. I learned from him what not to do. So, so that was one of the things that when I had the opportunity to become a preceptor, and I actually became a preceptor in Georgia before I came to Alabama, I wanted to open up opportunities for people, and I wanted them to know shortcut some of the process and not have to, they have to learn some stuff on your own, which, you had to do those things. But I didn't want to be somebody that, you couldn't get any information from me, find out on your own, find out like I did, that kind of thing. I was never going to be that kind of person. So I think that's one of the things that prompted me to become a preceptor. Yeah.
Well, that's a great story too. So I will say you were very transparent, open, definitely, share with the staff, but also with me, allowing me to engage and be involved in meetings. And just
did a good job with that too.
Yes, I appreciate it.
You did that.
Like you said, that second string quarterback.
Oh yeah.
That second string quarterback. Yeah, I'm just shining bright. You're
doing that. Okay. There's the facility calling me now. These things, but anyhow, can I just text her real quick?
Yes, sir.
Just tell her. I'm sorry. Let me just text her real quick.
Keep
and tell her.
Keep going.
Sherry, you want to? Okay, just
keep going.
Okay, I'm just gonna text her and just let her know I'm doing a podcast. What you man? Just can I call you back? All right, let me just let her know.
Because you can edit this out.
Okay. All right.
Huh? Oh, you paused it or something? Huh?
Want me to answer?
Yeah, go ahead.
Okay,
Yeah,
let's
you
answer.
proceed.
Okay.
All right, so Reg, so what advice you would give to someone aspiring to become a nursing home administrator?
Okay. I would give them the advice of, making sure it's kind of what they want to do. I mean, I would tell them to definitely come in, meet with, administrators, kind of like you did, maybe tour some buildings, things like that. Talk to a couple of different people, because as you know, it is a 24/7, 7 day a week commitment, and the responsibilities are, you're responsible for people's lives and that kind of thing.
Right.
So I advise them that, first make sure that's what you want to do. Second, I would say to definitely learn, learn how to deal with people. And I say learn how to deal with people, because everybody's, going to be different,
Right.
and everybody has a different skill set. So what you need to do is figure out, what your skill set is, and figure out how to utilize whatever your strengths are to get other people. Because again, your job is to get your job done through somebody else.
Yes.
And everybody's not a people person. So you'd have to, if this is what you want to do, because at the end of the day, the people that you're trying to get them to do the job are the people that are responsible for these very frail elderly or these very sick people that are, at your building, because they have this need, the neediest of all, or the frailest of all. And so you have to figure out in yourself, how am I going to do that? Is it something that I want to take on? Do I want that responsibility? And if you say yes, then the next thing I would say is, all right, then now you need to, these are people who are already administrators or just wanting to get in?
Just want to become an aspiring administrator.
Okay.
Looking to.
Then again, look for a mentor, like how we talked about. Look for somebody who you think that you can get with, because you're going to need that kind of guidance, and
Yes.
if that's what you want to do, try to find that. And then if you can't, if it takes you a while, if you can't find that, then go to agents like Florida Healthcare, some other organizations, and kind of find what resources there are to at least give you enough background or guidance.
Right.
Because I think as a new administrator, young administrator, the regulations are going to be one thing that you're going to learn. You can't memorize the regulations. That's going to be something you're going to focus on.
Yes.
But the fact that if you can at least get that guy, or find somebody that you can mentor, or that can be a mentor, or somebody at least give you some advice. Personally, I would say do that first.
Right.
Don't just get out there and don't have anybody to, that you can call for advice, or that you can, go to. I think you need that, at least, something to kind of at least get you started.
Right. What are some foundational pieces you would say that could help? And I don't think we sort of dealt with that during my AIT program, because I know it was a little personal, but I would say, what advice you would share with someone that's becoming a nurse home administrator, or is in a brand new role as a nurse home administrator, of how to balance their professional life and personal life?
Okay. I think that's so important. I think that a lot of people don't know how to do that. And I'm even me initially, and as I've gotten older and I've talked to my family and things now, there was a lot of times that wasn't balanced. If I had to look back over time now, or to say some things I would have done differently, that would probably be one of them. Because as early in your career, and then especially early in a facility, it's all consuming.
Awesome.
You lose a lot of family time.
Yes.
You lose a lot of important events in your kids' lives and things like that. And I have to give my wife a lot of credit, because again, I have 3 adult children now who are all very successful and things of that nature. And I have to give most of that is due to her, in that, because a lot of things I missed. So I would give advice to not, to definitely not neglect that part of it. So yes, you've got to be, tied in, you're administrator. You've got things that, that have deadlines that you got to do. But once you did, when you get some things done, go home.
Go
You
home.
know, because you're gonna some of those things are gonna be there the next day.
Yes,
You know what I
always
mean?
have
Things
something.
that you can, you know, you got to prioritize, and you have to actually be intentional about the fact that you want to have a balance.
Yes.
If you're not intentional about that, you won't have it because that the job can take everything. They can do that in that kind of industry. So you have to be intentional about the fact that I got to have balance. You know, I've got this plan with my family. I got this, and then take that time and do it.
Yes.
You know, let the company know this is what I'm going to do. You know, I got PTO for a reason. I have work-life balance for a reason. Take it. You got to do that. If you don't, early in your career, you'll be burned out.
Yes.
It's going to happen because it's just, I mean, it's that kind of industry. You know, and you know, you've got several regulations. You got surveys that pop in unannounced all the time. You got things happening. You may have your day totally planned about what you want to do. You get in the morning, you're in the morning meeting. Somebody comes and says, "State's here."
Yep.
Everything's thrown off.
Oh, I used to have my little to-do list, and I just try to feel good about myself. I do about 2 or 3 of things on there. You know, try to maintain organization, but it's always, you know.
Yeah, and that's one of the things I admire about you too, as well, is your organization. Yeah. That's one thing you're definitely better than me at, because we talked about that. You were, man. One of the things that we talked about, and I don't want to go backwards, but I have to now. So you brought that up. Was that in your AIT experience? You know, and I've had several AITs. One of the things about you, Norm, was and again, how when I say find a mentor and find how you mesh with somebody. One of the things that when you and I mesh, we do some things. The way I did some things didn't necessarily mesh with how you know, were operating, and so you actually took the time, which is good, because like I said, I love that. Was that, like, you know, it's better for you? You see, he was telling me, if I have, you know, more structure as to what we're doing. Because, you know, I would go in there, I fly by the seat. Dude, everything's going to be different. We come in, and what happens is going to happen. We're going to make it go. We're going to Yeah, but again, you know, as I thought about it, too, because you're trying to learn, too, at the same time. So you need to see, you know, what's happening here, what's happening here, what's happening here, and not just go at this point. So one of the things that you did is as far as, like, trying to even structure, you know, like, look, okay, I got you. You know, we're trying to do this. All right, well, here's what I'll spend this one with this one. We'll do this with this. If you, and again, if this meets your approval, so just
meets your approval.
And I was like, that's wonderful, Norm. That's good.
Thank you.
But I'm saying that's the thing. You've got to get into it, and you want to be organized, and if you organize, things will go better. But this industry, because of the way it operates, and because you're taking care of people, and there are people with so many different illnesses and situations, and you're managing staff, and all your staff are different. You've got all different cultures. You've got all different personalities. You got everything that you have to deal with. You go in, and your plan for that day may be A, but it turns to B very quickly. You know, and then also we're in Florida, where, you know, certain times of the year, you know, we've got the hurricanes that come up, and all of a sudden now you're playing
good old Florida.
Yes, you know, where you're having to evacuate your facility. You know, you're having to either accept people in your facility, but you have to have a plan for it and that kind of thing. So I would definitely tell a young administrator to make sure they plan for that other balance. So when they take that time, get away from it, unplug, do that. Because you need it.
I think the key piece, as you said, is definitely obtaining a mentorship. And I'm understanding that in my life in general now, like with different aspects of my entrepreneurial space and what I'm trying to become, is mentorship is really important. Like having that guide, a person to just, you know, consult with and, you know, give you some pointers and tips. And so what are the top 3 areas? I know what you told me. A brand new administrator or any administrator should focus on as operations. Okay. Yes.
You need to understand with the facility as far as their survey history. You know, so that's, you know, you basically have to know that. So if you go to a facility, and I know we talked about that, so you can actually plan what you want to do operation in the facility. If you go in and look at at least two sets of pieces of paper, first and foremost, you look at that survey, most recent survey, kind of see where the state has sided the facility, and then look at their financial statement. If you do that, then that'll tell you kind of where, you know, if the facility is being profitable, if it's not, where their weak areas are, those kind of things. So those are the two key things, first and foremost. And then you said, was the third thing you said? Well, you asked me three things to focus on?
Three areas.
Okay. And then the third thing I would say is look and see what your staffing kind of situation is.
Mm-hmm.
What managers you have, where you have openings, what how the staff moves as far as getting along with each other.
Yes.
That kind of thing. What kind of team you've got, the culture of the facility, and see what you've got to do when you first get there, because that'll tell you a lot.
Yes.
Okay, your survey history. You've been cited. Actually, my first facility I went to in Georgia, coming from Alabama, I went to a facility, and it was in Brunswick, Georgia, a small facility that had a terrible survey history because of what they were talking about. And it actually had been run by a church organization. And I was hired by a company that would go in and fix problems, And so I was hired by this company. They sent me to this facility. And at this facility was, I want to say 40 beds.
Mm-hmm.
They gave me the survey report because they had to come back. And the survey report was 40 pages. Okay. So, all right. So I'm reading through 40 pages of deficiencies for this small facility.
And that was back then too.
That was yes, that was like probably 91.
Yeah. So
early 90s.
That was like 3. I was 3 around that time.
Yeah, so you're a young man. A very young man. But you were a very, very young man.
Yes.
Thanks for that. Okay, but yes. So yes, I went to this facility in Brunswick, Georgia, and and the staff, and I walked in the building. Actually, what I did, just to tell you, they before I went, I was going on Monday. They brought me in on that. I came over there. They put me up in a place on the weekend. So I went in like on Saturday. I was in jeans, just kind of walking around the building. And again, there were a lot of black administrators around, period. And so I was just walking through the building, just kind of seeing how they interact and that kind of thing. And I saw a lot of people just, sitting around, not doing much. Walked around, looked, I saw patients, hanging out of bed and all this kind of stuff. I'm like, wow. Receptionist wasn't at the desk. Nobody didn't say nothing to me. Nobody stopped me. Walked around, just wandered in like I'm getting a stranger off the street. Walked around, walked all the way to the back of it, looked around. Nobody said anything to me. Walked back out, went back to my hotel. So Monday when I came as administrator, we had a meeting on Tuesday. And when I had a meeting on Tuesday, I had the 40-page deficiency report. And so I got up from the room and I said, look, the community, the state, everybody thinks we're a terrible facility. This says we're a terrible facility. I don't know how you guys feel about it, and I don't want anybody to have to take it personally, but this is what the public sees. And with this, we got a whole lot of problems we got to clean up. Then plus I came in Saturday, I walked around and I saw kind of a lot of things that was showing that, we got a lack of care here.
Oh, yeah.
It
goes a long way with your staff too.
Yes.
Coming on a Saturday, yes.
Yes, but by looking at that report, that showed me the guidelines. First and foremost, we got to get started right now. Let's stop. We don't have the room to play. We got to get this corrected, and the state was going to come back for survey anyway. So, that's like I said, very important that you have those kind of pieces to guide you, so at least you know where to start.
Yes. Okay.
Yeah.
So you've impacted so many lives, from in the elderly community to families, loved ones, to individuals in the industry as well. What would you say is your most memorable or highest compliment you've received?
Wow. Well, I think that's one of them right there. You said that. I think, I've had some people say to me, Andre said the same thing kind of that you said, that, it's life-changing, man. What you did for me was life-changing.
Life-changing.
And again, I didn't do it thinking that. But the fact that, that's, how it turned out, it's probably one of the highest compliments, I can get in this industry.
Well, and I coined the name Florida's the Black Godfather, nursing home administrator.
Right.
Black Godfather. That's gonna be the title too, Reg.
Okay, no problem.
Yes, sir.
I appreciate you, Norm.
Yes, sir. I mean it, man.
Yeah.
Last question here before we get into game portion is, what's the best life advice you've ever gotten.
All right, that's a good question.
Where did you hear? Where did you hear from? And who did you hear from? And
One of the first ones, I guess the best professional advice I got. My first facility in Tuskegee, Alabama, my medical director was an old doctor named Dr. Dow. And I was a 28-year-old administrator, new into Alabama, new in my role. He walked in my office, and at that time, everybody thought it was very professional. We called it Mr. and Mrs. I was probably the youngest person in the building, and he said to me, Mr. Eldridge? I said, yes, sir, Dr. Dow. He said, you don't ever have to supervise anybody. I said, okay. He said, as long as you're going to take responsibility for whatever they do. And he just walked out. So I was sitting there thinking, okay, so I guess what he's saying is I better supervise some people. Because as I thought about what he said, he said, if I don't supervise, I'm still responsible. It doesn't matter. You don't have to do it. But my responsibility is for whatever they do. Right. So, as far as professional advice, it's probably, it carried on throughout life. And as you know, as an administrator, we're responsible for everything that happens in the building. We talked about 11 to 7. We can be home in our bed, sleep. Something happens on 11 to 7. We're still responsible for it. Yes. So,
just thinking back, at Dolphin, the Health and Rehab Center at Dolphins View.
Oh, yeah.
Over there in South Pasadena.
Oh, yeah.
There's them late night calls.
You know it, man.
And that was my first facility. Yeah. So I thank Consulate Healthcare for giving me that opportunity.
Yeah, I think that was probably most professional advice. Yeah. The other thing my mom said to me, and again, it came up with kind of when I was talking about trying to get along with people. My mom told me years ago, let's see exactly how did she word that? Let's see. I want to say it had to do with, trying to I can't remember exact wording that she had. I tell you asked me that, I was going to think. But anyhow, it had to do with getting along with people, even if you're having conflicts, without being confrontational. So her exact wording, and I can't remember what it was right now, but it had to do with being able to, not always agree, but to not to do it in a way that was always disagreeable, kind of a way of putting it. If I asked my sister right now, she'd remember exact wording of that. But she told me that, and until you asked me that, I can't remember. But again, those two pieces of advice, one professional and one, personal.
Right. So as here on the Let's Get Comfy podcast, as I stated, we a sponsor of peace, joy, love, and happiness. So we have to end on a high note.
Okay.
So we have a game we're going to play here that's called the 7 versions of me. Okay. So it'll be the 7 versions of Reg.
Okay.
All right, and you get 7 seconds to answer each one of these. Okay. All right. The first one is Reg as a husband.
As a husband. All right. As a husband, I am. My wife would say something different. I try to be a little more understanding. I don't listen enough, So I'm trying to learn as an old husband now to be more understanding.
Good. Okay.
Per se.
All right. Reg as a father.
As a father, I've also had to learn again because I said that, I do appreciate each one of my kids. They're doing things very well. They're always very successful, but I needed to, and now have been, learned more of, I guess, empathy is another thing that I think I've learned over time. I can give you an example, but if a game I don't want to change again.
Go ahead. No.
I'll give you a quick one.
Sure.
Okay.
Yes, sir.
All right. As a young person, and I talked about kind of my father moving and that kind of thing, and I had to move. There was one situation where grades 1 through 6, I was in Rochester, New York, and everybody in the school looked like me. Every person that I went to school with from grades 1 to 6 was a black student like me. Ooh. In my 7th grade year, at age 12, my dad took a job in Central New York, and I went to a school that started from 7 to 12. And I was the only black student of 1,200 students, the only one, and I was a 7th grader. So it was probably a defining year for me in trying to figure out, my identity for one thing, and trying to adjust to a whole new environment. it was stressful year. It was a real stressful year for me.
Right.
I don't think I took that into account as much when, as an adult going on my jobs and how the change would be for my children. And as they got older, I learned more about that. So I guess as a father now, I guess I feel more empathetic to kind of how they were coming up.
Good.
Yeah.
That's good. That's a good example. Reg, as a sibling.
As a sibling, I was the older sibling. So, I kind of was the boss, I felt. My two younger siblings, I get both doing well. Now we're more on a level playing field than we were as I'm coming up. Again, we've come as adults. We're doing pretty well. We stayed in touch. We actually like each other.
Good. That's good.
That's good.
Reg, as a son.
As a son, especially now, my mom is very much. She's elderly, obviously, and struggling. She lives closer to my sister up in Carolina. My father's passed. I try to, again, learn some of my lessons and being, like I said, I started out kind of problem kid early on, to now seeing my aging parents be more as their caregiver. And my sister and I both are caregivers for them now.
Right.
So at this stage I am now, that's kind of how I am as a son.
Yeah. All right. And as an entrepreneur?
As an entrepreneur, I think one of the things that I think is important, and I always listen, you kind of always kind of be open to ideas. You don't have all the ideas. You kind of got to put yourself in position to where if something comes available, or you networking with people, just like you kind of talk about, that kind of thing. If there's an opportunity that you can cash in on it, or that you can at least be involved in it. So I think as an entrepreneur, you always have to be open. You have to not close yourself off to, it's not health related, or this is not this. You have to be open to, because you never know what the opportunities are, which is another thing I'm proud of you about.
Thank you, sir.
You're not limited. So again, another thing I'm proud of you about knowing.
Thank you, sir.
Good.
As a friend.
Yeah, I think that's very important. I think you don't really have, if you have true friends, and nobody can have, you say, I got 50 friends. Well, no, you ain't got 50 true friends. People that you can really count on, or that you really can be there for, and that they can be there for you. If you got some of those people in your life, I think that you live well. I think that's important.
And the final version, Reg's impact on his community.
All right. Well, my impact on the community has primarily been, like I said, through healthcare. I've been administrator of several facilities, and I've had so many different, numbers of staff. So there's been, hundreds of people that, I've been administrator of, or I've impacted their lives in some way or the other. And also, I guess, trying to be involved in other organizations as well, through churches and through civic organizations. I try to involve myself as well. I don't want to limit, can't just, Reg is a nursing home administrator.
Right.
And plus, I still have a lot of involvement with my military friends and others. Right. So I think, that's kind of how I impact the community.
Yes. All right. And the last game we have, Reg, is called That's My Answer. So you get 3 seconds. It's a this or that type of game here. Okay. And it's referred to your preferences. Okay. All right. So, bad breath or body odor?
Oh, I gotta pick one.
You gotta pick one of those. Oh. Bad breath or body odor? Which one is your preference?
Man, it's gonna be bad.
Yeah, which one you got?
I guess I have to say bad breath. They're both gonna be bad.
Bad breath. Okay, bad breath. Okay, Red. All right. So, punch or slap?
All right, I'm gonna have to take slap because hey.
Yeah. Okay.
Yeah.
Chicken or seafood?
Chicken.
Okay. 5 shots of tequila or 3 Long Islands?
I'm gonna do the 3 Long Island.
3 Long.
Yeah, I've tried the 5 shots of tequila.
God, it was rough. You're mixing with Long Island, and you have 3 of those.
Well, there's 5 shots of tequila.
We call it Earl, and
Yeah, I've done the shots of tequila.
Yeah, okay.
I've done that.
Dancing or singing?
Well, I don't do either well, but I probably would say Maybe singing.
Singing, okay.
Yeah.
They going through a little battle right now. Drake or Kendrick Lamar?
I think Kendrick Lamar was winning that one.
Kendrick, yes, I agree with that.
Yeah.
All right. Now, don't get in trouble here, Reg. Cardi B or 6 Red?
Okay. Okay, so just I have to pick one of the other.
You got to pick one of the other.
For the purposes of this.
This, yes.
Okay, and again, this is for purposes of Norm's
yes.
game.
Yes.
I would have to say, wow, that's a good one. I guess it's Cardi B, I guess.
Cardi B, okay.
I think Cardi B has a little more talent.
All right, Biggie or Tupac?
Oh, wow, okay. I like both of them. I think I'm going to go with Tupac, though. I think Tupac, yeah, I vibe with both of them, though.
All right, they had their little situation, but Will Smith or Chris Rock?
All right. Chris Rock was totally wrong.
Yeah, right. Exactly.
I mean, Will Smith, they should not have done what he did. So if I had to pick one, I think. Oh wow. Well, in that case, I'm gonna have to go. That's ugly. I'm gonna go with Chris. It's a jokes. It's because he's a comedian.
Right.
Will took it. I think he took it in a way that.
Yeah. It's just when she looked at him.
That's what it was.
He was laughing at first.
That's what it was.
He was laughing. He laughed to win.
Yeah, I gotta go with Chris on that.
Right.
I'm staying with Chris.
Okay. Plies or Jay-Z?
Okay. Jay-Z is a legend. I'm gonna have to go with Jay-Z.
You're gonna go with Jay-Z. Okay.
Yeah,
Kevin Hart or Cat Williams?
Wow, that's another good one, man.
That's another good one.
Yeah, and both of them are good comedians. Cat is wow. And I only have 3 seconds, so I can't really explain my answer. Right?
You can go ahead.
Okay, explain my answer. All right. I think Cat is more, again, as far as with the street and with the folks, whereas Kevin is more commercial. And I like both their humor, and I like the fact that Kevin, is an entrepreneur as well and doing all those things. And if I had to choose a career, I would probably choose Kevin's career.
Okay.
Just as an individual, I'd probably go with Kev.
Kev, okay. All right. Own a jet or own a plane?
To own?
To own one. Which one would you own? A jet or a plane?
Oh, probably a jet.
Jet? Okay.
Yeah.
Why? I want to know why on that one.
Okay, I think that
because I watched Soul Plane. That's how I came up with this answer.
Okay.
Yeah.
I think a jet, anyhow, because I'm thinking about trying to a plane. I think needs too much other stuff to if I want to be somewhere.
You're trying to get
there. Yeah. I can just shoot up the jet and just go.
Okay.
Plane, you got to do some a whole lot of other prep and everything else prior to to doing it. But I think the jet can get in, go to little smaller airports. I can land anywhere. I don't have to land at a big commercial airport and all those kind of things.
Okay.
That's right.
Hunt for food or fish for food?
Hunt for food or fish for food?
Or food. Which one?
Well, now that I told you that I have gone fishing, I'm going to go with the fish.
Fishing, okay. All right. Rush Hour Chris Tucker or Friday Chris Tucker? Which one do you take?
Good. Rush Hour.
Rush Hour?
Yeah.
Okay. And the last and final one, Beyonce or Megan Thee Stallion?
So you let them do this? You let them do this?
Yeah,
okay.
Beyonce.
All right. Okay.
Yeah.
All right. Okay. I think I'm about to go with Megan on this.
You'll go with Megan on that?
I think so.
Okay. All right. We're going to just let the answer stay that one.
We'll leave it at that.
Yes, sir. So, man, we have, again, the Black Godfather Nurse Home Administrator. So happy to have him join us here on the Let's Get Comfy podcast. I hope you've enjoyed yourself and been filled with laughter, joy, and peace, but most of all, comfort. All right. This podcast is about empowering others, empowering the community with knowledge and resource to age comfortably, but we bring an edutainment to it. All right. I'm Norman Harris. It's Reginald Eldridge. Thank you.
Thank you. Good job there, Norm.
Yeah.